Hello everyone, this is Sijing Wu. Today I'm going to narrate our group assignment in physiology. The topic is Listeriosis in animals. So in order to better know about Listeriosis, we have to know which body part is affected. Listeriosis in ruminants primarily affects the nerve system, and we have some examples here. The first one is spinal cord membrane. Spinal cord is protected by membrane known as meninges, which are distributed by surrounding the spinal cord. The second one will be ipsilateral weakness. Muscle weakness or paralysis that occurs on the same side of the body as the neurological lesion or injury. The next one is the brainstem. The primary system in the body affected by listeriosis causing the brainstem to be severely damaged. The last one is the bloodstream. Listeriosis affects body streams by first entering the body and then spreading to various organs, leading to septicemia, generalized blood infection. Alright, we have already know which body part is affected, but how does it usually works? The nervous system controls and coordinates all body activities by sending signals between brain, spinal cord, and nerves. Brain and spinal cord always work together to control movements, reflexes, balance, and body positions in ruminants. Brainstem regulates vital body functions such as breathing, swallowing, and heart rate. Meninges protect the brain and spinal cord from injury and infection by forming protective layer around them. Blood-brain barrier prevents harmful substances and bacteria from entering the brain and affecting normal function. Overall functions keeps the animal alert, coordinated, and responsive, allowing normal behaviors such as grazing, walking, and maintaining balance. So, what have been changed? There are three we want to mainly talk about. The first one is brain. Sheep are particularly sensitive to bacteria. Once the disease has become neurological, it can cause death. The disease can also affect the system by causing the animal to have a head tilt, loss of balance, cranial nerve deficits, and unusual body spasms. The second one is spinal cord membranes. Once the disease has spread to the spinal cord, it affects the animal by inflammatory process, which causes another disease called meningitis. After meninges are affected, it can cause hemorrhage in the affected meninges. The third one is the bloodstream. When the bacteria enters the bloodstream, it can cross the intestinal barrier, causing it to invade certain organs, which is called invasive listeriosis. Once the bloodstream has been infected, it can cause septicemia, which is blood poisoning, and in pregnant ruminants, it will cause abortion. These are the changes we cannot see on the surface, but what we can see from the surface, there is several that we can see. There may be dangerous response due to the infection from the body. There may be ataxia, nystagmus, head tilt, dropped jaw, circling, as well as neonatal mortality. There may be breast issue, inflammation leading to bacterial infection, infection of digestive system that causes inflammation, and may also cause anorexia and depression. So, how does the symptoms affect our physiology? So it can cause a typical blood clotting, cause vital organs not to get the blood they need. Burst blood vessel or small blood clots can damage or destroy surrounding tissue. Nystagmus specifically affects animal balance, coordination, vision, and lead to ataxia, which can cause knuckling. It can also cause abortion, increased stress, uterine health risks such as infection, physical discomfort or pain, and possible hematological changes, especially in cows. There will be inflammation or damage caused to the mammary gland, reduced milk production, metabolic or digestive issue, impaired reproduction, and toxic metastasis can cause death. It can disrupt the normal fluid and electrolyte balance, gut barrier, and nutrition absorption, all of which can be life-threatening with rapid loss. It can enhance immune function, increase the production of white blood cells, increase the metabolic rate, significant behavioral changes such as lethargy, anorexia, weakness, and general heat-seeking. So, how are we going to diagnose this? Listeriosis is diagnosed by isolation and identification of L-monocytogenes. Specimens of choice are usually brain tissue from animals with CNS involvement and aborted placenta or fetus. If the isolation attempts fail, ground brain tissue should be held at 4 degrees Celsius or 39 degrees Fahrenheit for several weeks and recultured weekly for adequate results. Occasionally, L-monocytogenes has previously been isolated from spinal fluid, nasal discharge, urine, fecals, and milk of clinically ill ruminants. Well, we all know how bad it is. So, how can we manage the disease? Recovery from the listeriosis depends on early, aggressive antimicrobial treatment. The survival rate with treatment is lower in cattle exhibition recumbency, excitement, and a weak or absent menace reflex. Below are most common treatment plans. The first one is penicillin. Penicillin should be administered at a dosage of 22,000 U per kilogram of body weight every 12 hours for 1 to 2 weeks. The treatment should be initiated with potassium penicillin intravenous and followed with procaine penicillin G given by intramuscular injection. The second one is oxytetracycline. Intravenous oxytetracycline results in high plasma oxytetracycline concentrations that facilitate attaining effective antimicrobial concentrations in the brainstem. At last, we have supportive therapy. The supportive therapies such as intravenous fluid and electrolytes are beneficial for those struggling to eat or drink. Okay, finally, thank you for your patience and thanks for our groupmate making those really cute PowerPoints. And finally, this is our reference.